But let's talk quickly about cretinism, which is hypothyroidism in a fetus. So the baby doesn't start producing its own T4 until it's about 5 months along in gestation. But so it relies on mom's T3, T4 for it to develop a proper brain. And then that's the issue. If it doesn't have enough T3, T4, then it's going to have significant effects on the nervous system production. Hashimoto's thyroiditis is the most common cause of hypothyroidism, and I'll let her explain that one. All right, hyperthyroidism. You are going to explain that one? No. It's an autoimmune disease, and it's the most common cause. Uh-oh.
Uh-oh.
Up to 95% of all cases of hypothyroidism are Hashimoto's thyroiditis. Ooh. And it's an autoimmune disorder. Of course, it occurs more commonly in women. We'll talk about autoimmune disorders later when we talk about the immune system, but autoimmune strongly affects women over men, in which the thyroid tissue is slowly destroyed. My replacement dose of levothyroxine is equal to my weight, which means that it's appropriate to my weight, which means that I no longer have a functioning thyroid, is what they're telling me, that it's been completely destroyed. All right, hyperthyroidism is also called Graves' disease. All right, it's another autoimmune disorder where the autoimmune cells act like TSH. They make the thyroid get bigger. And of course, the normal thyroid is going to be pumping out even more T3, T4. So hypothyroidism is someone slowed down. Hyperthyroidism is someone sped up. Is going to be that basic difference. And again, more common in women because it is an autoimmune disorder. And then there's a few other conditions, de Quervain's thyroiditis and postpartum thyroiditis. Yet one more reason to not have children. And then from your book, a comparison of hypo and hyper. Now, parathyroid glands have nothing to do with the anterior pituitary, but we're right there at the thyroid, so let's go ahead and talk about these. These are on the back side of the thyroid gland, and their job is to regulate calcium. So we've already seen how important calcium is inside a cell. We're going to see it even more next week when we talk about muscle contractions. Glues cells together, it's part of the coagulation cascade, and we know that it releases the neurotransmitter. Most of the calcium is in our bones. Phosphorus is also part of it. What makes up our bones is this crystal. This is, what's the name for it? Oh, there we go. Hydroxyapatite is what makes up the bone. It's a crystal, looks like that. That's what the molecule looks like. So when calcium is released, phosphorus is released as well. And phosphorus, we've already seen ATP, ADP, we've already seen that. Phosphorylating enzymes to turn them on. Activating protein channels so that ions will come in or out. So we've already seen the role of phosphate. It's the backbone of DNA and RNA. So it's an important regulatory molecule as well. So here's the feedback system. When our calcium levels drop, parathyroids sense that. They put out parathyroid hormone, which binds to osteoclasts, and osteoclasts, which are a form of a white blood cell, by the way. That was their original design. They start dissolving bone, which releases calcium and phosphorus into the blood. They also, the parathyroid hormone also causes the kidneys to activate vitamin D and increase the amount of calcium that's being absorbed by the intestines. And so then, of course, the negative feedback would be a rise in calcium. Vitamin D, we think of it as a vitamin, but in reality, it's part of the immune system. And we'll talk about that in a little bit here. All right, if calcium level's too high, there are cells in the thyroid that put out calcitonin, which block the breakdown of bone and causes the kidneys to dump calcium and phosphate. Osteoporosis treatment is when calcitonin is predominantly used. And osteoporosis, of course, the bones are thin, subject to break easily. Any questions about that one? I'll go on to ACTH. Adrenocorticotrophic hormone. All right, the adrenal glands, they sit like little hats on top of the kidneys, according to Dr. Collins. The medulla we've already covered. The medulla is a part of the sympathetic nervous system. The cortex is what we're going to talk about now. The cortex puts out these three classes of hormones. The glucocorticoids influence glucose. Glucocorticoid raises glucose. Mineralocorticoid is aldosterone, hangs on to sodium, gets rid of potassium. So those are minerals. And then lastly, they put out androgens, which are converted into either estrogen or testosterone. That's what it looks like. We have the dense irregular connective tissue capsule, zona glomerulosa, zona fasciculata, zona reticularis, and then the medulla. And notice that each zone is putting out the different categories of hormones. The glucocorticoids are essential for life. Notice that cortisol is going to be the primary one. They're making sure that we have plenty of building blocks in the blood. They handle the stress of just being alive, the stress of just getting up. Of course, they also rise under more significant stress, such as trauma or worry. So here's the pathway. Notice it's called the HPA pathway. That's how many medical texts are going to refer to it. That's what drugs are going to reference, the HPA pathway. Hypothalamus, pituitary, adrenal cortex is what HPA is standing for. So circadian rhythm or stress will cause the hypothalamus to put out more corticotropin-releasing hormone, which causes the anterior pituitary to put out more adrenocorticotrophic hormone. Negative feedback loop. So the hypothalamus is checking to be sure it's working. Then the adrenal cortex puts out cortisol, long feedback loops, back onto both. Then cortisol is affecting all of these systems. So cortisol suppresses the immune system, it causes increased production of glucose, it causes proteins to be broken down, it causes fats to be broken down. Because if you're in stress of any sort, including, like I said, just getting up in the morning, you need more building blocks in the blood. So that's why it's going to liberate more building blocks. Circadian rhythm, so it's mostly put out, notice, throughout the day. When it's time to get up, I have to have a huge surge of cortisol to get up. Again, it's going to be essential for life, but it is commonly given as a therapeutic drug. We need to talk about that. It suppresses the immune system, is the reason why it's given. It's given at much higher doses than what we can produce. So it binds to a lot more receptors than we do endogenous production of it. So that's why we get so many side effects from the use of steroids. So it's going to be used for any kind of inflammatory response that is causing a negative reaction. So certainly bad allergy responses, bad reaction to poison ivy. I had shingles once, so they gave me steroids for that. I hurt my back one time, they gave me steroids for that. And it's going to be in the category of drugs that keep transplanted organs from being rejected. And it's going to be taken by people who have autoimmune conditions to damp down the immune system that is destroying them. Now then, we have too much of a good thing. We have Cushing's syndrome and Cushing's disease. Cushing's disease, the adrenal cortex goes crazy on its own and produces way too much cortisol. We can also have a too much ACTH coming off the anterior pituitary. And then you also get Cushing's syndrome from high doses of steroids. There you can see what the results are going to be, and then there's a graphic showing you all of them. If you've ever taken any steroid at all, you've noticed the side effects that come with it are a huge piece of paper. It includes death, certainly, because lots of these things can cause death, is why. Can make you a little wacky, causes the face to swell. My father had prostate cancer for a number of years, and he took a drug that blocked testosterone blocked the receptors to try to stop the prostate cancer. And then after about 11 years or so, it metastasized, and it went to the bone. And I think I've already talked about this, that a cancer that metastasized is still called the original cancer. So he had pancreatic cancer of the bone. Prostatic, not pancreatic. Prostatic cancer of the bone. There was cancer in his bone, but it wasn't bone cancer, all right, because it was cancer that came from the prostate gland. So his doctor put him on prednisone. And I saw him after a few weeks, and I knew about moon face, but that's the first time I really saw moon face, where his normal went back planes came out, that his face really was like a plate. And got the buffalo hump, and he gained a whole bunch of weight. He was hungry all the time, peeing all the time because he had a high blood sugar, which is going to induce insulin resistance, going to wind up with type 2 diabetes as well. No longer had an immune system really, wasn't allowed to go to church anymore because he might wind up getting a cold and dying from it. Bones weakened, skin thinned. He got fed up taking so many pills, he just quit taking the prednisone. I'll explain here in a second why that's bad. Fell, broke his back because his bones were so thin. So long-term steroids are a problem. Now, if you need to take steroids briefly, that's okay. But long-term steroids, you don't want to be on long-term steroids. We need to find some other way, hopefully you can get off. And the issue, again, if you have an autoimmune disease that's destroying your body, you have to take steroids to suppress it. And then it will go into remission, and then you can go off your steroids for a while, and then you have to go back on them later. All right, I'll show you a picture of my dog, Tucker. Notice that Tucker was a chunk. Besides being zealous of his food, Tucker suddenly no longer became housebroken. He was peeing mass quantities of clear, uncolored urine. And it turns out that he had Cushing's disease, common in middle-aged dogs. It's the first time I ever had a dog that had it. And the vet talked about this. This is true for humans too. We need to talk about this. The negative feedback system. So, putting out way too much cortisol. All right, why? Is it Cushing's disease, which is the adrenal cortex putting out too much cortisol? How do we know? Strong negative feedback against the pituitary and against the hypothalamus. All right, what if it's a tumor on the anterior pituitary? High ACTH is the reason for the high cortisol. The hypothalamus, however, will be suppressed. So that's how that gets diagnosed, by drawing blood levels of these three hormones and see which is high, which is low. If it's the hypothalamic problem, such as, say, high stress, high CRH will result, which of course then causes high ACTH, which causes high cortisol. Now we need to talk about this because you're getting ready to give steroids to people. You become a nurse. When people are taking steroids, it causes strong negative feedback against the anterior pituitary and the hypothalamus. Remember that the anterior pituitary's hormone is trophic. So if it's not being produced, it causes the adrenal cortex to atrophy. The patient will no longer have an adrenal cortex. So if they stop taking the steroid suddenly, they will have no cortisol at all. They could die because cortisol is necessary to keep us alive. That's why steroids are always weaned. Always weaned. You don't just give a big dose and then give nothing, because there's a risk that the adrenal cortex is going to atrophy and then it won't put out cortisol anymore and the person will die. So those 2 times I took steroids, they were solumedrol packs. I took 7 tablets the first day, 6 tablets the second day, 5 tablets the third day, 4 tablets the third day. Oh, I'm losing track where I am. Every day, 1 tablet less, until on the 7th day I had just 1 tablet to wean me from the initial high dose. I used to give steroids in the hospital right after there was a particular thoracic surgeon that liked his patients at 4 in the morning to get a